What do you think are the top 3 common male problems in the bedroom? I'm Dr. Nazanin Moali, a licensed clinical psychologist, and I've counseled hundreds of single and partner men in my private practice in Los Angeles. I also get dozens of questions weekly from my listeners of my podcast, Sexology. In this video today, I will tell you about the top 3 challenges that men face and how to fix them. Before I go into the topic, if you like our videos, make sure you're subscribing and sharing this with your partner, with your friends. Okay, so let's begin with a true or false. Men are always ready for sex. True or false? The answer is false. Men are not always ready for sex. There are men that have low desire or hypoactive sexual desire problem. This is the 3rd most common male problems in the bedroom, and unfortunately is one of the most misunderstood challenges in men. Men are so frequently portrayed as horny sex machines in the media, and we always hear that people say that men think about sex every 7 seconds. The complaint I hear from the partner is he's always tired and doesn't want to have sex. Or they say that I know he's watching porn and masturbating, but he just doesn't want to have sex with me. Well, in fact, research shows that 15 to 25% of men struggle with this. That's about 1 out of 4 or 5 men. In my practice, I would say 50% of men that I work with are struggling with it. So what is hypoactive sexual desire? Basically, it's someone who doesn't have any or has very little sexual thoughts, fantasies, or activities. For it to be called hypoactive sexual desire, you have to struggle with this for at least 6 months, and it needs to be a source of distress for you. So how do you get it? Well, the reason for it can be medical, psychological, or relational. For the medical part, for instance, it could be because of high level of prolactin or low level of testosterone. A great first step here is seeing your primary care doctor. But this could be also because of unresolved mental health problems. Many of my clients working long hours and have stressful jobs. These people need to make lifestyle changes. My invitation for you is to prioritize sleep and practicing mindfulness. It can be helpful to learn to manage your thoughts, since your thoughts and emotions are connected. If you still have a desire for solo activity, then you should ask yourself, what gets in the way of you wanting to have sex with your partner? Many people are interested in kinky and or alternative sexual experiences, and they're so scared to bring it up with their partner. It leads to sexless relationships. All right, so let's go to the 2nd most common male problem in the bedroom, and that is premature or early ejaculation. This is a source of embarrassment and frustration for many of my clients. Sometimes your female partner experiences it as you being selfish or not caring enough, when in reality it may have nothing to do with them. Sometimes people have unrealistic expectations of how long a normal man needs to last. So how long do you think a healthy man should last? 1 minute, 5 minutes, 10 minutes, 30 minutes? Research shows that healthy men on average last around 5 minutes. For the purpose of mental health diagnosis, it is erectile dysfunction if a person ejaculates within 1 minute or less after vaginal penetration. And often research shows that 20 to 30% of people struggle with it. So how to treat it? For some people, antidepressant may help delay ejaculation, and your physician may help with that. What's interesting is that anxiety, depression, and low self-confidence are some of the reasons that lead to premature ejaculation. Learning to recognize the thoughts and systematically challenging them could be a great way to manage it. This is where working with a sex therapist can help you to build your sexual confidence, and would be a great strategy. So drum roll please. Now we're going to go over the top male problems in the bedroom, and that is erectile dysfunction. This is also the #1 issue I see in my practice. I hear from my clients on how disappointed they are at the amount of effort it takes them to gain an erection, and how frustrated they are when they lose that. The large study in Massachusetts showed that 52% of men struggle with this issue. By definition, to be diagnosed with it, you need to have difficulty in obtaining or maintaining erection during sexual activity, I would say 75 to 100% of time. Medical issues like cardiovascular problems, urological problem could cause erectile dysfunction. Of course, there are tons of psychological issues that can cause or compound the medical problem. The good news is that for most people, there are many techniques to help you experience pleasure with your partner in the bedroom without having to worry about losing the erection. And if you are interested to learn more, sign up for my 2-hour session on this same exact topic. In this session, I will teach you 7 tactics for achieving optimal performance in the bedroom. All you need to do is go to the link below and sign up for the class, and I will see you there.